Hello and welcome to the briefing. This is being brought to you by The Appeal and Now This. We have a really exciting show for you today. My name is John Matthews. I'm Senior Legal Counsel at the Justice Collaborative. We have 4 special guests with us today. I'm super excited to get into the substance and really inform all of our viewers here. Today we have the lovely and amazing Congresswoman Ayanna Pressley with us. We have Queen DA Rachael Rollins. We have Dr. Gavin Yamey from Duke, and we have Senator Robert Peters out of Chicago. Really appreciate all of you for being here and look forward to the discussion we're about to have. Just give me one moment because I do have some prepared introductions. I just need to pull them up. Okay, sorry for the technical difficulty. Let's just jump right into conversation. So today we're talking about decarceration amid COVID-19. This is a super important topic, and we're going to talk about all the reasons why. But I think first, let's get grounded and jump right into conversation. So, Representative Pressley, this is a super important issue for you, I know. And I think the best way to start is talk a little bit about yourself and your background, and also why decarceration during this time is so important to you.
Sure. Well, first, I just want to say thank you for doing this briefing. Thank you for giving a damn and for fighting so hard for our community members, because we are one community that are behind the wall. And everyone who is participating in this all the panelists that are part of this briefing today have been doing this work for a long time. And so it's an honor to do this work in solidarity with each and every one of you. Before I talk about sort of my lens and why I care so much about this, I just want to just begin with centering and bringing into the room Andrea Circle Bear. Just yesterday, we learned the tragic story of Andrea. She was pregnant when she entered prison in January, and it was there that she contracted the COVID-19 virus and was hospitalized. Ultimately, she was forced to deliver her baby while on a ventilator and died just yesterday, 4 weeks later. Andrea should never have been in jail in the first place, period. Her story is the story of so many people trapped inside of prison systems because of systemic inequities and a failed war on drugs. That she was there at all is cruel and negligent. And I can't believe that we find ourselves in a circumstance where I have to be introducing legislation like we did in the Momnibus bill, Justice for Incarcerated Moms, that we have to be pushing the Bureau of Prisons around guidance about how to preserve the life, the very lives of our most vulnerable. But that is where we find ourselves. And as the child of a formerly incarcerated parent, I know intimately, as do we all have loved ones that are behind the wall, unfortunately. But we do this work because we see all of them as members of our community and our loved ones. But I know that, one person doesn't go to jail. The entire family does that time with their loved one. And although my father is no longer incarcerated, I have spoken to many impacted family members, and they are so afraid for their loved ones that they have been left without any protections and would be lucky if they were even an afterthought in the midst of this coronavirus. And so based on my own lived experience and the work that we've been doing in our office for a long time, early on in this, in my oversight committee role, began questioning Dr. Fauci in some of the first public hearings, and pushing for the Bureau of Prisons to provide guidance as early as possible, because we know, and I'll end here, that incarcerated men and women are amongst the most vulnerable. People easily think of our nursing homes and congregant facilities like that, individuals experiencing homelessness within our shelters. But when they think of our most vulnerable, they don't include in that narrative incarcerated men and women. And that is because they don't see them as people. They don't see them as human. And that's why all of our advocacy is so important, and the push for decarceration, because these are petri dishes, ecosystems where a virus can only thrive and take lives.
Thank you so much for saying that and for starting with Andrea's story. I can't imagine what it would feel like to be in Andrea's family right now and to be dealing with such a great loss, both for a family member, but also, her child, her baby that fortunately they were able to save, is going to grow up without a mother, and it doesn't have to be that way. So I thank you for bringing that humanity and for bringing that context to the issue. So I think you mentioned something really important. I think it'd be a good opportunity for Dr. Yamey to jump in, because there's one idea about us seeing humanity in people and understanding that people are more than the worst thing they've ever done, right? As Brian Stevenson always says. But there's also very clear public health reasons why this is something we need to act on immediately, right? There's a sense of urgency here. And I wonder if Dr. Yamey can get into some of that, like just the public health, this is how these things are working, and this is why what we're currently doing is not working. Oh, you're muted still.
Thank you so much for inviting me to this incredible panel. And thank you so much for highlighting this important issue. So many of us in the public health community here in the United States have been concerned about jails, prisons, ICE detention centers, juvenile detention centers for some months now. And it is really just horrifying to see our fears come true. And as you just said, this is really about public health. Prison health is public health. Migrant health is public health. Homeless health is public health. If we forget these marginalized communities, if we forget these communities that are out of sight, out of mind, we will never control this epidemic. We will never control this global pandemic, and we ourselves are put at risk. Now, I happen to believe, as I'm sure everybody on this panel and hopefully everybody watching believes, that we should be protecting the health of incarcerated people, right? In and of itself, that is a human right, okay? People may have lost their liberty, but that does not mean that they should risk infection and death. However, beyond that, we also need to protect people in these settings, because we're not going to be able to control the epidemic with infections in these settings. Inevitably, because of the churn, the in and out of people going inside and outside jails and prisons and detention centers, if you have an outbreak of an infection in one of those settings, it will inevitably spread to the community. And you may have seen a study that the ACLU put out today suggesting that there could be an additional 100,000 deaths from infections in jails and prisons. Most of those, about 3/4, are actually deaths outside in the broader community. So for everybody's sake, right now, your health is my health, and my health is your health. An outbreak anywhere could be an outbreak everywhere. So from a public health point of view, we've got to stop ignoring this catastrophic situation in jails and prisons. And I hope we can, get into some of the steps that I think need to be taken immediately to prevent this catastrophe from getting worse.
Absolutely. Go ahead, Representative Pressley. You're muted.
Can you hear me now?
Yeah.
Okay. Yeah. I just had wanted to just build upon that. You know, that is exactly why early on, Senator Warren and I called on Trump to use his clemency power to release those individuals whose age and health put them at risk to serious illness. And again, have partnered with so many of my House colleagues calling for that greater transparency. We know we need more testing and treatment protocols. Whether they have any plan at all to sustain a large scale outbreak within these facilities. It's just not enough. I know we're going to keep saying testing, 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 but I'll tell you something. I was speaking with the president and CEOs of community health centers this week, and they have many patients who tested negative for the nasal swab, but positive for the antibody. So it's not enough to just test those who are asymptomatic, especially when we know that more than 25% of cases show no symptoms. To test those who are symptomatic, because we know 25% of cases show no symptoms at all. So what we do know is that solitary confinement is not medical care, and our prisons are not equipped to be hospitals. We have seen over 1,500 cases of COVID-19 in our federal prison system, and well over 10,000 cases at the state and local levels. And those are just the ones we know about. So what will we find out when widespread testing is done? And to the point about our county jails, I think the average length of stay, and you all can correct me if I'm wrong, is something like 3 to 5 months. So 95% of those that are incarcerated will be returning to our communities. And that's why for all the funding that I continue to advocate for, both for our states and municipalities and for BOP, it's really important that when we talk about those resources, not just about containment and mitigation strategies and testing and PPE, both for incarcerated men and women and also for those who work there, it's also that we have to have reentry supports. We have to have housing supports. We have to have healthcare supports, because what we already know from prison is that you can't treat trauma with trauma. So we're not going to remove people from one hell place to another. And so that's why it's important that not only we do widespread testing, that we fight for PPE for incarcerated men and women, because they're not equipped to be hospitals. You cannot physically distance there. And again, in our county jails, many will return. So this is a matter of the public health. But honestly, I believe our freedoms and our destinies and our public health are all tied. But I hate that I even have to make that point. Even if they were never returning, this is just about these lives, and they matter, period. And so we just have to continue to push for decarceration to bring that population down, both for incarcerated pregnant women, for the 10% of the population that are elderly and have underlying conditions, again, using clemency power, our juvenile detention facilities, and thank you for also bringing into the room our immigrant detention facilities.
Yeah,
John,
go ahead, Dr.
May I follow up on 2 points?
Definitely.
Congresswoman Pressley is absolutely right. And I think there's 2 ways to look at it. The first is that the conditions right now in so many jails, prisons, detention centers are appalling, and they are putting people at risk. There is overcrowding. People don't have access to just basic hand washing facilities and soap. Some people are shackled, right? And actually they can't cover their mouths when they're coughing. Those are conditions that are creating a tinderbox. And so we have to take steps right now to protect people's health and well-being right now in these settings. So that's point number 1. I think most people right now know what it takes to break the cycles of transmission. If I go walking in my neighborhood with my 4-year-old son and someone comes too close, he says 2 meters, back away. And yet people in prisons and jails are not even being given these basic protections, masks, social distancing. If someone is infected, they must be isolated. If people were exposed to the infected person, they must be quarantined. These are the basics, have to happen right now. That's number 1. And then the other point is that we have to decarcerate, right? We have to take the pressure off of these settings. And I was involved in an open letter to both the Trump administration and also here in North Carolina to the governor, to Roy Cooper, to ask for decarceration in a way that makes us safer. And I think that's the important point, that taking the pressure off these settings makes everyone safer, and we can do it in a safe way. Why on earth is any pregnant woman incarcerated right now? That is a moral disgrace.
Yes.
Now, it is true that we are not 100% certain of what this virus, this coronavirus, does in pregnancy. However, we do know that for similar viruses like influenza and other coronaviruses, pregnant women are more likely to get sick and die. No pregnant woman should be incarcerated, period. We should not have elderly people in jail. The chances of an elderly person committing a crime when they are released are practically 0%. They hover at around 0 to 1%. There are people who have medical conditions, diabetes, heart disease, who are at very high risk if they get infected. They should not be in jail, absolutely not. And honestly, I think every single ICE detention center should be shuttered right now. These are not safe places. They've had outbreaks of scabies, of flu, of all sorts of infections. We can decarcerate in a way that makes all of us safe. And we have seen jurisdictions do that. In the UK, where you might have guessed I am originally from, they've released thousands of prisoners, low-level offenders, done in a very safe way. And it makes everybody safer. If we continue to get these infections and outbreaks in these settings, they will inevitably spread to the wider community.
And doctor, I just need to say, Andrea didn't die because of COVID-19. She died from the worst thing of all, indifference. That's why she's dead, because of complete indifference. And the fact that the president and our governors can save lives with the stroke of a pen by releasing people who are elderly and medically vulnerable, releasing people who are nearing completion of their sentences, less than 1 year left, and expediting parole hearings and compassionate release, you're right, it is a moral crime. It's a deficit of leadership and in seeing the humanity in everyone.
Honestly, I have been left in tears by the letters that people have been writing to me in the last few weeks. Their loved ones are in a jail or a prison, maybe with a few weeks left on their sentence. And they are desperate. They are desperate to get their loved ones out. And the letters I'm getting are appalling. And that's why, today's briefing is so important. I hope it can make an impact.
Definitely. I mean, we need to talk about empathy and the lack of empathy and seeing everybody else as an equal partner in humanity, right? Because I think, as you mentioned already, we have a huge problem that people don't care about people once they disappear. Once they're in our jails and prisons, it's like, okay, they deserve to be there and whatever happens. But I think if you look at, and if you were to talk to most people would agree that committing a crime or even allegedly committing a crime for the folks that are pretrial in jails should not be a death sentence, right? And so I know Rachel is ready to jump in because she always is, and she speaks truth to power, and
yes,
she on everybody.
My DA.
That's right. So for those of you who don't know, DA Rollins, she's DA in Suffolk County. The large city is Boston. And Rachel, I know you want to jump in. Please let us know what's happening on the local level. And just to preface it, most people are locked up. The roughly 2.2 million people in our jails and prisons are at the local and state level. So, Rachel, I'd like you to give the perspective from a DA and just describe the challenges you're facing, both in terms of messaging and just with other actors. Representative Pressley mentioned the governor, for example. I know you have, as recently, I think maybe today, are writing another letter like, this is urgent, we need this to happen now. So feel free to jump in with some.
Sure. Yeah, so I echo everything that the doctor and my congresswoman have said. And I would just add, the way I like to frame it is, when we see in Massachusetts hotspots and outbreaks in places like veterans' homes, nursing homes, elderly facilities, and in the hierarchy, of course, everyone matters, but in most people's minds, it's, oh, veterans are, and they are, my father's a veteran, but we should be protecting them. As with our elderly, they are no different. If in fact, those places where in Massachusetts, we've seen horrific situations in Holyoke and Chelsea of our veterans dying, those facilities are better kept than our prisons and jails. And so I am proud that when CPCS, which is our state public defender, as well as MACDL, the Mass Association of Criminal Defense Lawyers, filed an emergency civil action with our Supreme Judicial Court on March 24th. We filed a motion to join them as the petitioner, not a respondent, because the Supreme Judicial Court said, okay, all of you sheriffs, all of you DAs, all of you members of law enforcement, you are mandatory parties here. And I said, yeah, I get it, but I want to be with the public defender and with the mass criminal defense lawyers because they're fighting for people's lives, whereas many of the other respondents were busy trying to maintain the status quo and say, everything's fine, don't look here. One of the things people don't understand about prisons is it is a mini police department, but in complete secrecy. At least when the police act every day out on the streets, they live with the potential fear of somebody with a phone making a video of what they're doing, or an individual being able to say, look, I know my rights, I can't do this, or some other witness being able to do this. By the very nature of where prisoners and people who are incarcerated are located, they have already been discredited. So it's a tinderbox, you're right, not only because of the conditions, and I'm proud that in the brief that I filed to the Supreme Judicial Court, I spent 4 pages explaining to our Supreme Judicial Court what a prison cell actually looks like. People don't recognize that most of them are, 4 or 6 feet by 8 feet with multiple people in them and an open toilet an arm's length away from you. The toilet doesn't have a lid. Many of these individuals, when they go to the mess hall to eat, it's in large groups. So the very things that we're all doing to flatten the curve right now, they are incapable of doing where they are. And the same sort of empathy and compassion we feel with respect to veterans and our elderly. I know it's hard for people's minds to go there, but we need to feel that same way about prisoners. Even if they have committed acts of violence or things that are reprehensible, they were not sentenced. At least in my state, we don't have the death penalty. Their sentence didn't include death by COVID-19. So we have worked diligently, even prior to the Supreme Judicial Court opinion. My office reached out to our public defenders and we reviewed over 209 cases prior to the lawsuit. Prior to being forced to do anything, we stood up and said, what can we do to make it better? And we agreed in about 35 to 40% of those cases, we 100% agreed with the criminal defense lawyer about this person getting out. And then there was another group of maybe I'd say 10 or 15 or so percent where we said, look, if you change 1 or 2 of the conditions, we can agree to that. And we bundled those to put them before a court. But remember, guys, our courts are closed right now, right? Things are really hard to move. I just sent a letter to Governor Baker today, but yesterday I sent a letter to Chief Judge Fabricant in our Superior Court to say we believe the grand jury is an emergency matter. We had a homicide on April 15th. We had a 10-year-old shot, and luckily she lived on April 18th. Usually, John, as you know, as a former prosecutor, we would be presenting some of these witnesses right to the grand jury to try to seal in their testimony right away. We aren't able to do that right now. So we have to have disruptors like Representative Pressley. We have to have disruptors like Senator Peters, and we need all of our different experts in all of our different areas to come together with Dr. Yamey and others to say, this is a public health crisis. We don't just need lawyers thinking about this. We need to cede our power to the medical professionals so they can tell us what we're going to do. We need our organizers to be vocal and loud, and we need our representatives to start putting forth legislation that's going to let us be nimble and to move quickly.
Thank you for saying that, Rachel. I want to touch on something you said, a couple of things. One, as a former federal prosecutor, as you know, there's oftentimes amongst our colleagues to just treat someone as defendant this, defendant that. They don't have a name, they're not a person. What's your message to other prosecutors? I mean, you already send messages to prosecutors in your office. So one, how have you tried to instill that empathy in your office? And also, before turning back to something I had regarding what Representative Pressley said, what's your messages to other prosecutors around the country, right? Who I'm sure have many things to say to you.
Yeah. So for those of us in the trenches that have actually tried cases in our municipal and district courts, overwhelmingly, not necessarily the federal cases, but many of our defendants are victims. literally, not literally and figuratively, right? So I have individuals that have been the victim of a gunshot wound, and we are working with them as a victim, and later either perpetrate a crime and commit a homicide or commit a gun violence crime of some sort. Or we see this and we have much more empathy with young children that are unfortunately sexually assaulted who later assault people, right? Sexually assault. That is unfortunately a characteristic based on no fault of their own that they offend after they have been harmed, right? And so I just try to change and shift the paradigm of reminding people that, you know, like Congresswoman Pressley, I have siblings that have been incarcerated, right? I have stood in the same courtroom that I prosecuted people in, and then later sat in that courtroom watching my younger brother get sentenced to 3 years of federal time. And so it is a really awesome experience to walk into the same place in a different role and see how disparately or differently you are being treated. So I talk about defendants all the time because we can't treat you poorly as a defendant, and then when you become a victim and we need you, treat you differently. And then if you're a witness, treat you even differently. You recognize us every time we come to you. And so we are trying to recognize that we are the government, we are in the public service industry, we work for you. It's my job that if you don't understand something, that is not your failure, it is mine, that I need to be better at explaining the process. And we are talking about the fact with that homicide, for example, not only the family of the victim that was harmed, obviously, and their life was irreparably changed in that moment. There was another family that got a phone call that said, your son did the following, and their lives, they are inextricably tied forever and forever changed. And so the system, the taxpayer dollars of that defendant's family go to the DA's office as well. When they walk into that courthouse, they deserve to understand the process just as much, and everyone is innocent until proven guilty. So we do that. And then the other thing with respect to my colleagues, I am, I like to say I did not take this job to make friends. I took this job to make change. And so you are either going to be with me or you are against me. And in these moments, and we are at war, like recognize this, like this is a civil war we are engaged in right now. If you are silent, that is assent. Get out of, move, lead, follow, or get out of the way is what I say all the time, because I am doing what is morally in correct and based deep in my character. And if you question me, that's fine. But I have autonomy in my job, which I love very much. And we are going to move forward and do what's right every time.
Thank you.
Well, I just want to say you have more than autonomy. You have a mandate from the people who sent you there, and you are honoring every promise you made. And we do not take your leadership and the strength of your convictions for granted one little bit, because you have done the unthinkable as a DA in pushing to decarcerate low-level offenses and poverty crimes, and and because of your advocacy, so many pretrial detainees have been released. So yeah. I just want to say
post-conviction, and I will add one thing, and then I'd love for Senator Peters to comment on some of this. Is yesterday there was a hearing for an individual named Arnie King, who is, I believe, in his late 60s, almost 70. And he is alleged to have committed a murder back in 1971. Arnie was 18 years old, African-American, and killed a vibrant young man who had just passed the bar exam and was working for the then mayor of Boston, Mayor White. And this individual was a cross-racial crime. So the young man that was murdered is white, and Arnie King, the defendant, is black. The DA that sat in my role was District Attorney Burns, I believe his name it was. And in 1972, our office, of course, I was 1 year old at the time, but the DA in my office and the ADA trying the case struck every black juror. Every single black juror was struck, and an all-white jury convicted Arnie King of murder. And there was the death penalty back then in Massachusetts. They decided for life without the possibility of parole as opposed to death. And Arnie, who is over 50, so he's in a protected age category according to the CDC, and is asthmatic as well, so in a heightened has an underlying medical condition that makes him more susceptible to possibly testing positive to COVID-19, filed a stay. And he already had a motion for a new trial. And the fight that I had, and it was a rousing fight, and my staff is exceptional and brilliant, and the case law did not support potentially supporting what it is that Arnie wanted, the stay that he granted. And I explicitly stated that although the case law may be in a place where it's not necessarily clear as to the position we should have taken, this is to a moral certainty. If my name is on the document that's filed with respect to anything, and by the way, my name is on every document that's filed by our office, then we are not going to be opposing the stay of Arnie King, because I refuse to say, well, there was no judicial notice taken as to the racial conditions back in 1972 in Boston. Or actually the case law that says that he was entitled to a new trial came out after he had filed his appeal, and they said we aren't going to look back retroactively. There are some things that we can do that are morally right. And I got a text that Arnie King got home to his sister-in-law's house last night in Grove Hall in Dorchester, and he received a standing ovation as he walked out of MCI Norfolk. Now that's one part of the story. The other part I need you to hear is that I had to make a call. My office had to make a call to the family of that person that was murdered and have the hard conversation to say, we are going to assent to or not oppose this stay for Arnie King. And that hurt doesn't go away. Just because we can say the murder happened 49 or 50 years ago, I am never in a place to tell somebody that there is a statute of limitations on pain and hurt. But we can't forget that there are victims of all types, and these decisions are hard, but when they are right, you do them, and then you make that phone call and you make sure that you are speaking, even before that, to the family of the victims and survivors so their voice can be heard. And even though I disagreed with the position they took, we made sure when we stood in front of Judge Sanders, their voice was heard. We made sure she knew that they had opposed his last commutation back in 2010, but that they hadn't returned our calls with respect to this. So it's important that I think we talk about victims and survivors as well in this process, because they have a voice as well.
So thank you. I want to talk about community, and Senator Peters, we're going to get you in on this now. You have background as a community organizer. You know, you're an elected state senator. Let's talk about, well, two things. Let's talk about proximity, one. So, and this is not only to you, but to Representative Pressley and DA Rollins, but how do you stay proximate? So, you know, you are all elected officials. There are directly impacted folks out there that are viewing right now. There are organizers out there. What does proximity mean to you, and how does it inform, you know, your decisions when trying to figure out how to handle this crisis and decarceration in general?
Yeah, I think for me, it goes back to the fact that I need to stay grounded. There's an accountability factor. Oftentimes when people get into elected office, they lose that connection to where they come from. And so to me, it's about being as close to those who are directly impacted, being as honest to folks who are directly impacted, being as honest to the folks that you organized with, so that they can call you out on your BS at the same time. So, you know, we have a prison, Stateville Prison, which is being, you know, literally destroyed by this crisis. But I visited that prison multiple times just to actually get policy recommendations from folks who are incarcerated. And they literally, they hold me accountable. I mean, we don't have parole in Illinois. It was not necessarily a main issue that I've been focused on. I tend to focus on pretrial detention, ending cash bond, pretrial reform. And I was trying to get out from having to make a commitment on parole in Illinois. And this dude, Joe, who was sitting next to me, put a lot of pressure on me to commit to bringing parole to Illinois. And I remember there's a table of us, there's 30 of us at this table. And I said, damn it, Joe. All right, Joe, fine. Let's do this. You win. I was like, that's good. And he pulls out like every policy paper he looked at in the law library. He's like, here, I got you, you know, and I think it's very important that you stay closest to those who are impacted, that you stay closest to people who are organizing, you stay grounded there, and then you know that if you mess up, they'll take you out. And the other part is you don't do it alone. You organize and you do leadership development. So folks who are organizing directly impacted should be the people who are now running for office, who are the political directors, who are the policy directors, who are in that leadership role, because too many of us play this role of expert, but we need to actually get people who know what it means to live this life into that position. That means for everything. I mean, across the board. I think about this same way in the fact that if you're a social worker, if you're a teacher, literally we need more people. Look, I grew up with a lot of lawyers for family.
Careful.
Lawyers, I love lawyers, let me tell you. We have a lot of lawyers in elected office. I want to see someone who's come out of Stateville prison being elected office. I want to see that social worker. I want to see that teacher, so that they can actually represent people who are most impacted by the last 30 to 40 years of failure by our government.
I love that. I have a really serious question for all of you. But before I get to it, I want to just note some polling. So Justice Collaborative Institute partnered with Data for Progress, Forward.us, and R Street. And what they found was 66% of likely voters, including 59% of those who are very conservative, said that elected officials should be considering measures to reduce overcrowding in prisons and jails as a response to coronavirus. 58% support releasing elderly incarcerated individuals, and 63% of voters support alternatives to jail, such as a summons or a ticket. Now, we can talk about those numbers, but for those of you who remember Willie Horton, and for those of you who don't, we can talk about it. But there's this issue, right? We deal with the media, like our organization deals with the media all the time, and I'm not going to attack the media, but one thing I want to talk about is how you factor in the media and like the one case that goes bad and the decisions you're making and what you're advocating for. Because, for example, I saw there was a story in the Chicago Tribune earlier, and it cherry picked a few cases where the person was released and then was rearrested on suspicion of committing a new offense. And it made me think, like, the Chicago Tribune is why we don't have nice things, right? And this is not just in Chicago. In Orange County, there's a lot of sensational. We were just on a Justice LA call earlier today and talking about, this really, really devastating reporting, which is, you should be afraid, drop everything. Why are we letting any of these people out? They don't belong in our communities. And I really want to know both how you deal with that in your advocacy, and also advice that you would give to all the advocates that are out, because and sorry, I'm talking a lot, but there's also this distinction that's who's worthy of our mercy, right? Because to be honest, any of these people could die because of COVID-19, right? And so how are you navigating these issues and really stepping up for all these folks?
Can I just chime in about that Tribune story? It has become an annual tradition for the Chicago Tribune to come up with a Willie Horton story to try to scare as many people as possible, to the point where this morning when I saw that story, I sort of rolled my eyes, because I said, here's another yearly article where they cherry pick some story, something to say, be scared, be afraid. And it's the same Willie Horton BS that we see over and over and over again. And I went from being an organizer with the End Money Bond Coalition to being a state senator. And this was constantly like a fear. There's like constantly a fear about this big newspaper story that's going to do this Willie Horton attack. And I said, at a certain point, they sound like they're just, the newspaper that cries wolf. When we look at bond funds and the people, and this was about bail funds, and the work that they do, they have a 90% plus success rate.
Yeah.
They do good work. You combine that with the fact that if you're rich and you're white, you still can get out in this current system. So it's not about public safety. There's an underlining theme that exists here to scare people, specifically in suburbia. And so for someone like me who wants to carry a bill to end cash bond in Illinois, it's targeting people. I need to vote for this bill. And what I say is, these people don't care about safety. What they know is that if it bleeds, it leads. What we need is what the appeal is doing, which is actual deep diving reporting that has empathy, that looks at people as who they are as humans, and says, here's a solution that will provide real safety to everyone. And so, yeah, the Tribune, it's just a regular boogeyman story, and I'm gonna just stop. First of all, I'm rambling and I'm ranting.
No, but I love it. I'm all in it. And by the way, P.S. shout out to Megan Rapinoe right behind you. I've already love it. Okay.
Oh, wait
So
a minute.
anyways,
I got beef because I was raised in Chicago and I root for the Cubs. So I just need to say that you're
Really?
repping off. Yeah, I grew up rooting for the Cubs. Sorry.
Okay. So let me say something. Let me say something.
Ayanna, I'm sorry. I apologize. You're great, but
Listen, don't get Rachel started on sports. So let's get.
We won't. And by the way, please tell me everyone is watching The Last Dance with ESPN.
Yes.
Anyways, we're moving on to something else. Okay, sorry. So back to what we were talking about, Senator. When I won my election, literally before I even took my oath to take office, there were articles of, is DA Rollins making us unsafe, right? Are we not going to be safe? Because I have this list of 15 types of crimes that are all low-level, nonviolent crimes that I said, let's envision a world where instead of the affirmative presumption being jail, it was not. It was services and treatment. And it's a rebuttable presumption, of course, right? It's not that it's, we are refusing to prosecute. That's not what I'm saying. I'm just saying, instead of a presumption of incarceration, let's have a presumption of, for these 15 types of crimes, rehabilitation, right? Or some sort of restorative solution, right? Or some alternative that is, there's accountability, if that's even the right word, because I can't hold you accountable for your mental health issues or your substance use disorder or your food or housing insecurity. That's not accountability there. What I want to do is try to lift you up and go to the root cause of why you were coming in contact with the system. But what we have to do is be brave. Like you already are saying, the media is going to find that 0.01% of the cases where, look, see, you let somebody out on a bail or the bail was reduced due to COVID-related issues, they got out and they just broke into a car or they just harmed somebody or did something else. And what we need to do is we need to stand up and say, you're right, that happened, and it is unfortunate, but as of right now, according to our data, and this is why data is so important, and we are tracking all the people that we are opposing their bail or assenting to their bail reduction requests, and say, but in 87% of the other cases, we have had no issues in the last 2 months, right? And what I am not going to do is lead by anecdote or change, right? By anecdote or one-off situations that the sort of conservative media wants to sell papers on. But you have to speak about it, because when you're silent and you pretend that it didn't happen, then it takes fire. You have to be able to be bold and say, you're right, this is unfortunate, but according to our data, this is an infinitesimal, I'm making up words now. It is the smallest little drip drop of a possibility, and I'm not going to let that dictate the rest of our decisions.
Yeah, I would just also, look, I don't, it is just deeply distressing that people's lives become clickbait. And that's really all this is, right? When I think of my father, here's someone who was battling a substance use, an opioid addiction, was in and out of the criminal legal system for 14 years, incredibly destabilizing, for our family and all those who love my father. My father committed crimes to support his addiction, but my father was no criminal. And it's why I keep fighting for Pell Grants and things like that for incarcerated men and women. My father was incarcerated at a time where he was able to receive an education. He attained 2 advanced degrees. went on to become a college professor and a published author. And that's actually why, I don't know if you can see why I'm wearing this hoodie today. It has the
Mug
shots, right? Incredible disruptors and leaders and influencers. And every time I leave MCI Norfolk, I am so upset and sad, depressed at the innovators, the geniuses that we are leaving there who facilitate restorative justice circles better than people that are on the outside. So the media is going to do what they do. I think the onus is on us to challenge their narratives. And that's why staying close to the pain and in proximity is so important, to diversify the narratives, to diversify the storytelling. And again, my father committed crimes, but he was no criminal. What he needed and deserved was on-demand, culturally competent treatment to address the traumas that he experienced with he and his siblings growing up in a what at the time was called a colored orphanage, because of the deaths of both of their parents. So they're always going to do that clickbait thing, but we just have to continue to center people's lives. And the other thing is that I've always believed the people closest to the pain should be the closest to the power, driving and informing the policymaking. And so I stay acutely uncomfortable on purpose, so I never grow complacent, but also so that this work is led by those who are most impacted. Because by staying in proximity, it's not only where we better understand the complexity and the nuance, but it's where we find the solutions. And on the solution front, I do just want to, offer this. I know folks are overwhelmed right now, and it is easy to feel defeated. And you're sort of like, well, you guys are writing letters, and what does that mean? Well, that's about accountability. That's about documenting our advocacy. That's about creating public pressure. And it is working in some instances. So on the federal level, I'll say, what we were able to get for the $850 million for states and cities, the $100 million for the Bureau of Prisons to focus on containment and mitigation strategies in PPE is not enough, because decarceration is what we want the most. But we have remained steadfast in our advocacy and our push, and Speaker Pelosi has committed to us that in the next relief package, that there will be language to address what we are discussing in this briefing today. And so that's why we have to be unwavering in our advocacy, because although it never feels that we're moving at the urgency we need to, given the scale and scope of this unprecedented hurt, we do have an impact. So we just have to keep raising our voice. And in Massachusetts, I'm going to say, and, Rachel and I aren't speaking out of turn because we speak to the governor all the time, but, Governor Baker, any governor for that matter, needs to act with the urgency this crisis requires. And they can save lives with the stroke of a pen.
Absolutely. Absolutely. And so to echo this, our Congresswoman, who is obviously dope as fire, when the Congressional Black Caucus came to Massachusetts and Boston with her, she convened them at MCI Norfolk. So we went into one of our state Department of Correction facilities, and I was fortunate enough to be invited as well with some state reps. And so, Senator, when I hear you talking about that, our Congresswoman has done that. Me as the district attorney of Suffolk County, my office was often the one prosecuting and sentencing the very people that I now sit with. And as DA and as a candidate, 16 times I've committed and actually shown up to go to DYS, which is our juvenile system facilities, to House of Corrections, which is of course our sheriffs who are elected, and our DOC facilities as well. But to the Congresswoman's point, in the letter I sent to the governor, I did say he is doing a wonderful job in many circumstances, right? He has done a lot to procure PPE and constructing field hospitals, but I did say I have grave concerns about the inadequate deployment of resources to our state's jails, houses of corrections, and prisons. And then I called out our parole board. who had been complacent and hadn't made any changes at all regarding a global pandemic that happened, and in fact only started to move after the wonderful advocacy of our public defenders and our Mass Association of Criminal Defense Lawyers filed a civil action in our Supreme Judicial Court. But what I did specifically say, Congresswoman, is that we are asking the governor humbly to consider exercising his powers of pardon and his powers of commutation, which, to your point, is with the stroke of a pen. Now, granted, with some hard work of his Executive Office of Public Safety and Security, EOPS, and his Secretary Turco, who is a friend. We don't agree on everything, but I respect the work that he does. We need to work together. I've offered myself to cull through all of these records, each one that represents a human being that is there and potentially in harm's way or potentially death, to say we will cull through and find you the ones that we don't believe pose a material threat to public safety, so that you can consider your exceptional powers and help them there, and that you can also push your parole board to start acting with the urgency that it needs in order to get these individuals out. Right now, guys, before this was filed, this lawsuit, 320 people had already gone before the parole board. The parole board had already said to those 320, you are eligible for parole. We approve you to go home. But there's a 2 to 3 week period where you have to get all this work done to get something called a parole permit. It's literally your get out of jail free card, where they have to make a lot of phone calls and notify victims and make sure you have a place to live, etc. They hadn't expedited that process at all. And it took the lawsuit for them to do this. And it's going to take the letters from our Congress people, our elected officials, the district attorney to say, I urge and deplore you to do better and to be better. So to your point, Congresswoman, letters, I know people think, what does that matter? It does. It documents where you stand. It demands an action. And when people later try to say, I had no idea, you can point to it and say, yes, you did, because we told you.
And
then
I would also just add, because I know I have to get going in a moment, but I'll just say that, I'm so grateful for your leadership and your partnership, all of you on this, the appeal and the Justice Collaborative and our DA and the doctor and our senator. I appreciate all of you immensely. But just that this work is not just for people with a comma, and a title after their name. What we need, that's my asthma. What we need is for when people are talking about the need to have reoccurring payments and not just a one-time direct cash assistance, and the need for rent cancellation and mortgage cancellation and the moratorium of evictions and foreclosures and the need to cancel student debt and more money for community health centers and all of these things that you are adding in your advocacy, along with your concern for the most vulnerable, our seniors, low income, for our undocumented, our uninsured, for those experiencing homelessness, that you are including incarcerated men and women. There are over 240 positive COVID-19 cases in our state corrections facilities. That's 240 lives. There have been at least 7 deaths. This is a crisis within a crisis. And I want the families who have been impacted to know that many people care. Many people. The Congressional Black Caucus, we just held a town hall last week. There were 400 plus that participated in that. At the top of this COVID crisis, the emergence of this, many of us got on a call from A Color of Change, Justice Collaborative, the Appeal, a bunch of folks advocating for our immigrants, and there were 8,000 people on that town hall. So there are many, many people that care, but we're at the point right now where it's not enough for you to be choked up and to be moved by a story. We are not traumatizing people to talk about their fears for their loved ones' very lives for the sake of, so what people need is action. And what we need is the collective amplification of all our voices. So I appreciate all of you, but we are only as good as the will of the people. And I know you all care. So show up, because these are our community members too. Yeah. And the last thing I want to say is stop only going to Black and brown elected officials. I know that, you know, because of mass incarceration and the failed war on drugs, that we represent the lion's share of those that are behind the wall. But every elected official is accountable to you. And if this matters to you, then you need to be raising it to every elected official and asking them, where are you on this issue? So
Love it.
thank you
Righteous.
all so
And
much.
also just remember, you know, with respect to Dr., I want to ask you, so in
I
Massachusetts,
gotta
as you
go.
know, all right,
Thank you,
we
Representative.
love you.
Appreciate you.
In our prisons here, Doctor, we had on Friday 47 prisoners testing positive at MCI Shirley. And then on Monday, 106 had tested positive at the same. So in a Friday, Saturday, Sunday, Monday, we had more than doubled that population. What we're seeing, Doctor, is that we don't have enough testing happening. And then the little bit of testing that we see, over 50% of the corrections officers and staff, which of course are the ones coming and going every day in our Department of Corrections, not our prison population, but they're potentially infecting their loved ones, which are out in the community there. But when you see an increase in 3 days of 50% from a health perspective, that is, I'm not a doctor, it's terrifying.
Sure. Look, if you take the 10 hotspots right now in America of where the worst outbreaks are, 8 of them are jails or prisons. And I think if we are trying to think about bringing down you know, the epidemic here, we are, of course, the global epicenter right now of this pandemic. We have the worst epidemic in the world. We are still not in a position in any state to be releasing lockdowns. We are not seeing the kind of prolonged reduction in daily new cases that you would want to see. Then we have to start paying attention to these settings, right? We will never get on top of our epidemic in the United States if we ignore these settings. And let me just say, I work in international health. I think Singapore is a very good example of what happens when you don't think about certain communities. Singapore was doing incredibly well at controlling its epidemic, and it was being hailed as kind of a model country. 6 million people. They had forgotten about their 300,000 migrant workers who are living in appalling conditions. Dormitories with up to 20 people in a room, you know, no soap and water, no social distancing, and they now have the worst epidemic in Southeast Asia. And the parallels with what is going to be happening here are really profound. There is no way out of this crisis in the United States if we don't think about where these hotspots are and we don't immediately put in place protection measures. We've got enough data to act now, right, to protect folks. And we don't need to wait for more information. The various surveys that have been done have found astronomical rates of infection in prisons, jails, ICE detention centers, and immigration detention centers, juvenile detention centers. We've got to act now with some urgency.
Absolutely. Robert, Senator Peters, I saw you had some comments.
Yeah, and I got to go here in a second. But I just wanted to say, I was going to say 2 of the hotspots are in Illinois, Cook County Jail and Stateville Prison. But the thing I want to say is to sort of piggyback on the fact that what you see is you might get a CO who gets sick, and you might see someone who's on staff get sick, but someone who's incarcerated, let's say it's pretrial, they get out, they get sick. But what we're seeing is a systemic issue, which is if we don't deal with the fact that people who are essential workers, people who are incarcerated, people who have housing insecurity are all on the same map. It's the same map in Chicago. It's Black folks who are doing the work, who get incarcerated, who have struggled to have the housing that they should have, who have lower wages than they should have, right? You see that it's the same exact map. And so when it comes to the care that they need to get through this crisis, it's even harder. So it's not only the fact that you might get incarcerated here, it's the other fact that even when you come back to the home and the community that you live in with the family that you have, you are still put into a vulnerable situation because of systemic failures that have existed. So I think for us that we need to look at is that we need to get people out of prisons and jails. Those are congregate facilities, and people are incarcerated and they should go home, be free from a disease. And then not only that, we need to make sure that we have a world that gives those people the healthcare, the love, and the dignity that they deserve. So if we want to make sure that we are looking out for public safety, it can't just be a talking point or a boogeyman. It's going to need to require material changes to people's lives. And so for Black folks, for centuries, have been impacted by this failure. This is a moment for us to say enough is enough. Enough locking up folks, enough not giving us the PPE and the pay and or even the PPP loans that we deserve. Give us the resources we need. We'll reduce incarceration. We'll be able to live that life, because that CO who got sick gets to go home in their nice little house in a certain part of Chicago, where they get to be able to self-isolate from their family, and they have enough money to get by. So we need to think about this as a holistic, systemic approach, and that this disease is sort of showing a mirror, a reflection of failures that have existed for far too long. I've got to go. I just want to say thank you all.
You're amazing.
All of you amazing.
I want to just add to that right, like to the senator's point, I think social distancing is it's a privilege, right? Like it's an entitlement. And, if you work in sanitation or as a grocery clerk or at a supermarket somewhere, or you work at a restaurant that is now in Massachusetts, they aren't open any longer, but they can do to-go foods, you don't have the ability to call that in or Zoom into a meeting the way that many of us with privilege actually do. And I will just say that before we finish this, one of the things I was proud that I said in the pleading that we filed, because I always think shame is also a wonderful way to force people to do things, is just to say other jurisdictions have shown leadership and collaboration in expediting decarceration in the name of public health to fight COVID-19. Around the globe, Iran and Ethiopia, and this was back on March 27th, I filed this, have released thousands of prisoners to contain the spread of this deadly virus. Ethiopia did so with the World Health Organization confirming only 12 cases of COVID-19 in their entire country. As of 2 days ago here in Massachusetts, 11 people had tested positive to COVID-19 in the DOC alone, and we had done nothing, right? So to your point, we need to look to our, in Massachusetts, we do believe, mostly because of our amazing sports teams, that we are better at everything than anyone else, and that we don't need anyone's help. We are wrong about that, right? And in particular, lawyers, I think, feel we got this, everyone else, you peons, go back there, please, and talk about whatever you want to talk about. We're smarter than all of you. We are not. We need you, Dr. Yamey. We need you, Senator Peters, to help us, even if it's from Chicago or wherever the heck Dr. Yamey's calling in from, like the UK or something.
Durham.
I don't know.
No, I'm in Durham, North Carolina.
Right. Okay. Durham, North Carolina too. Right. But the point is we have to collaborate, not just as my Congresswoman and I do, but across the country to talk about what's working in Cook County. What are you seeing, Dr. Yamey, in North Carolina, so that we can learn from you without having to deal with the very issue itself with us? And the only thing I'll add is the problem with COVID-19 happening, we need people going out there and filling out the census, no matter what, right? Our immigrant communities are terrified of going forth and even testing positive or getting a test for COVID-19 because they think they're going to be deported. And that's happening all over Massachusetts and Chelsea, which is part of Suffolk County. But we need, in these elections that are happening, you have to get involved. And in the census, you must vote, because we're not going to get another chance for another 10 years.
Thank you so much. And thank you all so much for your leadership. I think it's clear this is a public health crisis, and you can't get well in a cell. Our people can't get well in a cell. And for our community out there that's watching, whether you have been impacted directly, whether you still have family that are in jails and prisons, we're praying for you. And I don't care what you did, and everybody here, regardless of the crime that someone's committed, that should not be a death sentence. And we really need to think about a care first model and how to really address, and this is during COVID and after, like how we're going to have a care first system and really, not take the mantle of having the most incarcerated people in the world, right? And so I look forward to further conversations. You guys are great. Tomorrow, Josie W. Rice will be hosting, and the guests will be Congresswoman Rashida Tlaib will be returning Leslie Herod, Tim Black, and Greg Kassar. So make sure you tune in tomorrow at 11 a.m. Eastern Time, if I'm not mistaken. And again, thanks to you guys, thanks to the appeal, and now this, and we'll see you next time.
Thanks, John.
Take care.